Kia ora koutou katoa. Welcome, everyone. Today, I'm setting out our plan in the event we have a new case of community transmission of COVID-19 in New Zealand. I am going to take a little bit of time to do that, but at the conclusion then of those remarks, I'll be happy to take any questions, as will the Minister of Health, who's joined me for this stand-up today. Since we moved to level 1, we have continued work to ensure we have an ongoing level of preparedness for resurgence of COVID-19 in New Zealand. The framework I will be speaking to today has been through a cabinet process and, of course, is more important than ever. It is designed to give the public and our business community as much certainty as we can around what to expect if new cases inside our borders are found. This plan is a direct response to requests from the business community in particular for that level of certainty. And of course, this is something that we all must be prepared for. We have been 75 days without community transmission here in New Zealand. But COVID is now exploding outside our borders. And every country that we have sought to either replicate or draw experiences from in the fight against COVID has now experienced further COVID community outbreaks. We need only look to the experience of Victoria, Hong Kong, Singapore, and Korea to see examples of other places that, like us, had the virus under control at a point in time only to see it emerge again. This does not mean that anyone has failed. It means that perfection in response to a virus and a pandemic is just not possible. That is certainly the case as we see this pandemic continue to grow. The World Health Organization this week reported the global infection rate is nearly 13 million cases, with over 215,000 cases reported globally on Tuesday. To put that into perspective, when we closed our borders on the 19th of March, there were 240,000 cases in the world in total. It's 50 times worse than that now. We see this growth in cases around the world reflected in the steady stream of New Zealanders returning from overseas, some of whom are bringing the virus back with them, which we continue to contain at our borders. In the main, the pattern of returnees carrying the virus reflects the state of COVID in the world, with our cases coming from places like India, the US and the UK. New modelling by Rodney Jones indicates there will be over 100,000 new cases a day in the US by the end of the month, nearly 70,000 cases a day in India, and nearly 10,000 cases a day across Europe by August. We will continue to welcome home New Zealanders from these places as citizens, as they have a right to come home to their legal place of residence. But with that right comes risks, and the need to continue ongoing stringent measures to keep them and everyone around them safe. Victoria in particular is a cautionary tale. It appears from the current outbreak is linked to a managed isolation facility similar to the ones we run here, and that the entire outbreak was seeded by just 2 cases. That goes to show how quickly the virus can spread, and it can move from being under control to out of control. And even the best plans still carry risk in a pandemic. It is important to remember that our border facilities have served us well so far. Our testing regime is picking up cases amongst new arrivals who are in quarantine, and nearly 30,000 people have been through a facility without a case of COVID transferring into the community. But there is limited room for error. Just as many of our frontline health workers, like nurses, who are in contact with COVID patients, got the virus from those patients during level 4 lockdown, our frontline border and airline staff and staff in our managed isolation facilities are in daily contact with returnees carrying the virus. Even our most experienced and trained support workers have in the past picked up COVID. Experts tell us that even the best precautions possible, the chances of the virus passing from a surface or contact with someone of a carrier is still high. That is why we must prepare now for that eventuality and have a plan at the ready in the event that it does occur. The first thing we need to do is continue to ensure our border and our managed isolation facilities stay as tight as they can be. Minister Hipkins has been visiting some in recent days and I'm sure can answer any questions around some of that work, but we've already ensured our frontline workers at the border are safe by wearing appropriate PPE, getting regularly tested, and that our symptoms for managing returnees are robust and limit the risk of spread. As I say, the system has done the job it was set out to do to date. The work by Minister Woods and Air Commodore Webb in recent weeks have made significant additional improvements in this space and will continue to improve the system. Australia is currently conducting an audit of its quarantine system, and at the end of last week when I spoke with Prime Minister Morrison, I asked if he could share any insights they might learn so we can continually learn and improve on what we do here with our quarantine. But again, no system is 100% foolproof, and around the world we are seeing even the most rigorous measures being tested by the virus. So today I'm setting out the next stage in our COVID plan in the event we have new cases in the community. The first thing to note is that the government's strategy for responding to the COVID-19 pandemic remains elimination. That has not and will not change. Allowing our hospitals to be overrun, further deaths and the economy to close down again for an indefinite period of time is not a strategy. We have seen overseas the toll that takes on lives and economies. We've said from the start that the best approach for the economy is a strong health response, and the evidence has supported that approach throughout. We can already see that with New Zealand's economy more open than most places because of the steps we took to break the transmission under lockdown. Our plan moving forward seeks to protect that position and minimise any economic impact of future cases. So in the event of new community cases, we will move immediately to implement our stamp it out approach again. There are two key things to remember. Firstly, the simple approach of limiting the ability for the virus to move from human to human to break the chain of transmission remains the foundation of our response no matter what. That's why our key public health measures remain important for protecting ourselves and each other from the spread of disease. They are: wash your hands regularly and thoroughly, cough or sneeze into your elbow, don't go to work, socialise or be out in public if you are sick, and keep a digital diary of your whereabouts by downloading and using the COVID Tracer app. These principles are key to the second ongoing tool in our response: rapid contact tracing, testing and use of isolation and quarantine for those exposed to COVID. That is why the COVID Tracer app and whatever other means of recording where you have been remains vital. Every time you step into the world, I want you to ask this question: if I come into contact with COVID today, how will I know? And how will others know? If you are in or near a situation of community transmission, this will be an exceptionally important tool for contact tracing and for finding you. In this area, we're constantly looking at how we can use new technology to strengthen our response. The same goes for testing. But these are the principles we're all familiar with. Now I want to touch on what will be different. The alert level system and framework remains in place, but in the event of cases, rather than apply the framework nationally, we would look to apply our alert level system at a localised or regional level in the first instance. Our priority will be to control any cases with the least intrusive measures and over the smallest area we can. In practical terms, that means doing absolutely everything possible to avoid the entire country returning to alert levels 3 or 4 as a measure of last resort. Our stamp it out approach is scenario specific, meaning that our actions will depend on the severity of the situation. And of course, when we see the first COVID-19 case beyond the border, you can expect us to move very quickly and very firmly to contain it while we gather information on the situation we're facing. However, there are 3 broad starting scenarios we can plan around. The first, a case or a number of cases in the community. The second, a larger number of cases or a cluster in a region. Third, multiple clusters that have spread nationally. Let me run through what each scenario quickly might look like. First, a contained case or cases within a community. We would be looking at applying strong restrictions, but only applied locally in a neighbourhood, town or city to contain the virus and stop its spread. We would likely remain at alert level 1 nationally. The local measures to contain the case would involve rapid contact tracing and isolation of cases and their contacts, scaled up and targeted testing of people connected to the case, such as workmates, those they live with, or those in their neighbourhood. The point with this scenario is we'd look to act hard and fast but local in an attempt to ring-fence the virus. The second scenario is a large cluster within a region. Here, a significant increase in testing would be the priority. We would look to undertake much wider community testing on top of testing any contacts or potential contact of those with the virus. This could look like it did in Victoria, where health staff went door to door to test those in affected areas. We would also take steps to stop the spread to other parts of the country, so a regional shift in alert level would likely be applied that restricted travel. This would mean travel in or out of the city, town or region could be stopped, people in that place asked to work from home, and local restrictions on gatherings implemented. The aim here is to contain the spread away from other areas to avoid the whole country having to put in place restrictions, so we can remain at alert level 1 nationally, depending on the evidence of risk of spread outside the region. The final scenario is if there are multiple clusters spread nationally. In this scenario, we would most likely apply a nationwide increase in alert levels to stop transmission. Now, there is an underlying assumption in all of these scenarios that we know whether we have a contained outbreak or not. Where we don't have full information, we will take a precautionary approach and then scale back as needed, rather than run the risk of doing too little too late. Ultimately, though, as with the original application of the alert levels, we will be guided by science and what we know works. Internationally, the evidence remains that going hard and early is the best way to stop the virus and ultimately delivers the best results for human health and the economy over half measures that aren't as effective at getting on top of the virus and then sees countries in lockdown for longer. We've learnt much from the first wave at stopping the chain of transmission and eliminating community transmission. We learnt that if we act fast, we can stop the virus spreading. We learnt that if we restrict contact, we can stop the virus spreading. And we learned that everyone being vigilant and following the rules worked. No one wants to go backwards, but the reality is our fight against the virus is not over, and we must have a plan at the ready to protect our current position if it comes back. I believe we can do that, because the facts show when New Zealand's team of 5 million goes about implementing a plan, it works, no matter what comes our way. I'm now happy to take your questions.
Are you working on the assumption that we are going to see community transmission and it's going to come from quarantine?
I'm working on the evidence that we've seen around the world. Even those countries that have been in a position like New Zealand, every single one of them have seen cases re-emerge. We must plan for any eventuality, and what I'm setting out today is such a plan.
Would just one case in a community trigger a suburb lockdown?
Oh, it very much depends on those circumstances, but what we're indicating today is that we will move at a local or regional level if that's what the case suggests we are dealing with before we would move to national. But we will move swiftly and quickly to contain in the first instance.
When we were moving down alert levels, you raised concerns about shifting certain regions and it being different to national. What's changed now?
Well, of course, at that point, we had cases across the country. So when we were first dealing with COVID in New Zealand, we had cases that had come in through our borders that were scattered across the country, and then clusters from things like weddings that spread throughout the country. With a potential re-emergence in the future, we may well deal with one case in one area. What we're indicating today is we would in that scenario move swiftly, but we would look to move regionally if that was what was required first.
You mentioned that this was to reassure business. What have they been telling you?
Oh, look, actually, it's more just to set out some expectations. This is about preparedness. And in the same way the government is prepared, I know businesses want to prepare as well. So being able to give them a sense that if we did see a re-emergence, that we wouldn't necessarily in the first instance have the entire country move, but we may move locally, gives them a sense of what to expect if we had that eventuality.
Can you rule out moving back into a nationwide level 4 lockdown?
Oh, we've always said we'll do what we need to do to contain, if we had an outbreak in the future, to contain it in the way that we have before. So, of course, we have an alert level framework. We're willing to use it locally, regionally, or nationally if needs be. But the first step, if possible, would be local.
You raised concerns before about having regional lockdowns in terms of restricting travel. So how would you envision that playing out?
Yeah, and so when we developed the framework, we did do the work at that time around how we would implement it regionally. That would require us to use borders in a region or even in a city. We would require the support of our agencies to establish those borders. But the view of Cabinet is it's better to establish those borders to contain regionally or locally, if possible, rather than move nationally. And if the evidence suggests that's what would need to be done, then that's what we would move to do.
Or would that be roadblocks and perhaps the military there?
So depending on the level that the regional local area would move into would depend on whether or not you had those enforceable roadblocks. But if you do have an outbreak that means that we are asking people in a region to stay at home, then it would include at the same time not moving between regions. The whole point of a regional level 4, for instance, would be containment. We wouldn't want it spread elsewhere. Again, this is all scenario planning for us to demonstrate what it would look like if we had another case, how we would deal with it locally, and what the country could expect.
Cabinet has previously considered this plan and drew up New Zealand based on civil defence lines. So is that what the regions that you would look to move different regions into again? Is that how you divide the country?
Yeah, so we have used civil defence as broad frame parameters in the past. We've also looked at local government areas and we would maintain a certain level of flexibility depending on what kind of outbreak we saw. Look, we've seen in some parts of the world they've applied lockdowns to apartment blocks and workplaces. It has in some areas been as contained as that. In other scenarios, it could be a suburb, it could be an entire town. It will depend on the evidence that we have in front of us. So what I'm talking to today is the flexibility that we will demonstrate, but that we will take a precautious approach. We'd much rather take that approach than find that we haven't done enough in the first instance.
So it would be an as and when you'd decide where the regions were.
Yes.
So if there was a outbreak, then you'd be like, okay, all of Hataitai is locked down.
Yeah, very much depending on where you saw the source of the outbreak. So whether or not it's affecting, a community as a whole, whether or not it's affecting workplaces within that community, we will work on the evidence that we have around the kind of outbreak we might have and whether or not it's single or clusters of cases. But again, the message here is, in that eventuality, we wouldn't necessarily be moving all of New Zealand at once, but we do have the flexibility to move regionally as required.
When you moved in New Zealand to a national lockdown, you gave a bit of a lead in time, 48 hours. Obviously, Kiwis weren't able to leave the country at that point or come into the country, but they would be able to, in this instance, move out of a suburb that's been locked down, move out of the region, if you were to give that lead in time. Would you still be looking to give 48 hours of lead in time?
I think what we've learnt through this entire period, and even from observing other countries, is just how quickly things move. And so, of course, it takes a little bit of time. If you're restricting localised travel, it's almost easier to place those restrictions on a whole country at once than it is necessarily in a situation where you would be establishing roadblocks and so on. So we have been working with agencies around the quickest time frame that could be done, and so that would give a bit of notice to residents as well. But at the same time, we know we have to move quickly. So those 24 to 48 hour frameworks, really you can't go much beyond that or you lose the effectiveness of them.
We're calling the shots. I mean, will you leave it, if say 24 cases show up in a suburb, will you leave it for a regional public health officer?
Look, at that scale, when we have singular cases, that's when, the minister speak to this as well. When you have singular cases, of course, the public health units do play a key role because they're on the ground, know the community, are interviewing those affected. And so, of course, for those cases, you do see a locally led immediate response. But as you can imagine, given the importance of this, you will still see strategic decision-making being made at a cabinet level.
In It's like at a cluster level though, I mean, where's the threshold?
Yeah, because clusters are so frequently affecting more than one community, that's when you see elevation. So really it's determined between whether or not scenario 1, as I set out, you might see lead at a PHU level. Beyond that, you'd see it elevated. But Minister?
Well, the nature of the people involved are going to, play quite a big role here. We all, everybody in this room, we're quite mobile. We're out and about a lot. Not everybody in the population is as mobile. People won't come into contact with a whole lot of people. And so the characteristics of the lives that the people lead who might be affected will play a big role here. That's where the rapid contact tracing is vitally important. It's where every one of the team of 5 million can play a role here and keeping good records of who they come into contact with, because the more accurate that is early on, the more we can be targeted in our approach.
If a region's going to shut down, if a suburb's going to shut down...
Oh, essentially, absolutely. That kind of decision making needs to go beyond a PHU.
Yeah.
Prime Minister,
I'll come to you, then I'll come to you, Tova.
You've painted quite a bleak picture of the overseas COVID-19, what's happening overseas with X amount of cases a day. Are you essentially implying that New Zealand's borders are going to be closed for a number more years than you had previously expected?
I've put no timelines on that, but what we have always said is that our borders continue to be the #1 area of risk, and so we will treat them as such. Our goal has to be keeping New Zealanders safe, making sure that we have a stringent regime in place for those who are returning home, as is their right, but it continues to be an area of risk that needs to be well managed.
Does this put any pressure or changed your thinking on the potential trans-Tasman bubble?
Well, I've maintained the same position now that I did 2 weeks ago or a month ago, that we will only move on our borders and any reopening with any other nation once we deem it to be safe. And so we have criteria. We expect to see the same things happening in those countries we would reopen with that we do here in New Zealand, including being free of community transmission. And if that's not present, then we can't entertain reopening at that time.
Prime Minister, how much of a threat does Judith Collins pose to you?
I think it's fair to say that I've, obviously, as you will have seen, spending more time thinking about New Zealand's response and economic recovery from COVID-19. I absolutely accept that there is an election this year, and there is no avoiding that. But at the moment, really it's taking a bare minimum of my thinking because we are still in the middle of a global pandemic.
How many national leaders have you faced off against?
This is number 4.
The most formidable yet?
I have to admit that I don't really sit down and analyse them all. My focus, my time, my energy is going into our COVID response, and that's as it should be. Look, I accept there will be politicking this year. I accept we have an election. But if I'm being brutally honest, my mind hasn't been particularly focused on that to date.
Hold on to your job though, right? Presumably you're going to be campaigning to win at the election, which means defeating Judith Collins.
But that will be determined ultimately around whether or not New Zealanders see me focusing on the things that matter to them. I think right now politicking doesn't matter much to them. They want to know that we're focused on COVID, and I can assure them we are.
Just ask you about the plan. You say there's potential for going door to door to test people.
Yeah.
Do you have the resources for that, and who would be undertaking that?
Yes. Look, we have left that open as a possibility. It would very much depend on the circumstances and whether or not, if you had a case, for instance, in a workplace, then of course you would be then focusing on that network rather than just a singular network on a postcodal community. In terms of our capacity, you will have seen that we had a period there where we were surging up to 10,000 tests a day. So there is capacity in our system, but I'll let the Minister of Health expand on that.
Look, one of the things I keep coming back to contact tracing, and I've been asked in this forum several times whether we have a gold standard contact tracing system. We will have a gold standard contact tracing system when every business and every public place is displaying a QR code, and every New Zealander is, every one of our team of 5 million is keeping a good, accurate record of where they are, because those are the things that are going to dictate how quickly and how effectively we can contain any potential outbreak of COVID-19 without the need to resort to more drastic measures. Because obviously, if we can map out where any positive case has been and who they've come into contact with, those would be the first priorities for further testing.
Just finish that line of question. Sorry?
So
I
you're
missed that.
saying we don't have a gold standard yet then?
I'm saying every one of us is going to. We've got the framework there for a gold standard contact tracing framework, but
What he's saying is it's reliant on all of us.
that's right. It is reliant on all of us playing our role. We all need to be diligent about that. You know, even I have to confess, in recent weeks, I have not been as diligent at scanning in everywhere as I need to be. I've stepped up my game on that, and I encourage every other New Zealander to do the same.
Why not?
Sorry. Yep. I actually, sorry, I was going to come to you on the Tracer app.
On NZ COVID Tracer, just 1 in 8 New Zealanders has registered the app.
Yeah.
Of those, just 1 in 60 uses it on any given day. Is that good enough?
No, it's not. You know, we do need to constantly keep in mind, what if tomorrow there is a notice of a case and we need to notify anyone who has been in a public place near or around that case. So someone using the COVID Tracer app exponentially improves our chances of being able to do that effectively. And so that is why we can set up a framework, but unless people are taking responsibility for themselves and recording themselves where they are or have been, that makes that job harder. We have to be vigilant. I understand that after 70 days of not having COVID in our community, that for some people it may have moved to the back of their minds. We can't do that. We're just not in a position globally to start thinking like that.
So how can you move to this targeted approach when it's clear the contact tracing system isn't there yet?
Oh, look, in the same way that we did before any of this technology ever existed. This technology enhances our contact tracing systems, but it is never the sole tool that we use. It will continue to be a process that involves people on the ground, interviewing, and then taking a precautionary approach of testing everyone that works, plays, lives with the people who may have come in contact with COVID. So that all remains in place. What it helps us do is put that extra precautionary layer in by the people that you might not even know you had contact with. And that gives us that extra layer of protection. Yeah, Jason.
Cabinet's previous discussions on regional lockdowns centred on using the military to establish hard checkpoints between regions. If there is community spread, should New Zealanders be preparing themselves to see soldiers in the streets?
First and foremost, you'd see the police. And that's what we used even when we went into our highest level of lockdown. We saw that use of the New Zealand police. So that's what they can expect. It would only be if we were stretched for resource or that we needed some extra feet on the ground, that if needed, we could then expand into the use of our military. But first and foremost, and this has been discussed by Cabinet, it would be our police who would be the first port of call.
You had a small number of people in the community who got out. Have you considered removing them from the community and putting them into
Yes, we have.
isolation?
Yes, we have. And that, in fact, was something that we have discussed in terms of management from even when we were at alert level 3 and coming down through. So even at that point, when we had cases in the community, a discussion was had with PHUs about whether or not, in order to stop ongoing family transmission, whether or not people should be pulled and put into facilities. So that is still a very real possibility that we may indeed do that to try and reduce down the likelihood of any further transmission.
Isn't there a fundamental problem with the design of the Tracer app, in the sense that it really does rely on you having your phone on you, remembering to get it out, you know, do all the things. People are people. It's a bit of a nuisance. Have you looked at redesigning that app to perhaps harness Bluetooth or some other sort of technology that makes it that gets the result you want without people having to?
Yep. So I'll come to the Minister of Health, but first, just on that. So what you're describing is an app that simply uses Bluetooth technology, so doesn't require anyone to activate its functionality, but it does mean it has to sit in the background of essentially the functions of your phone at all times, and it has to be switched on. Every country that has used that technology has had some issue with it, either interfering with people's car kits, their headsets, lack of accuracy in it picking up people in too wide a range. And every country that's relied on it has found that it hasn't provided the solutions they required. So that doesn't mean we aren't looking at alternative technological solutions, but I do think it points to the limitations of an app on a phone, because it does 10, I think human nature being what it is, if you have something that interferes with the day-to-day use of your phone, some people switch it off. So there are other options out there. The COVID Tracer card is something that has been explored, and we have continued to keep a very open mind over different technologies for the same reason that you suggest.
Where's the card at, Minister? Where are we at with
The card has been trialled and continues to be trialled, but it's human behaviour that really needs to be tested.
Yeah, look, we're looking at all of the different digital solutions that might be available, whether it's GPS, Bluetooth, and so on. There, as the Prime Minister's pointed out, there are pros and cons with all of them. And so, I'm not taking any of those off the table. We're looking at all of the different options to see what the best solution for New Zealand is. Some GPS offers some interesting options there too, but not so good for people who are in dense urban or inner city areas, because where you're going up, it creates some issues there. So we're looking at all of those options. The fastest change that you'll see to the existing QR code app, which will come out within the next week or two, are changes so that people can manually enter appointments and contacts into it. So if they're going somewhere where there's not a QR code, so they're going to visit relatives or whatever, they'll be able to add that in as well. So we are providing a solution where people can keep a complete record of all of their contacts. That's one of the criticisms of the current app, that it doesn't provide a complete record. So we're working on adding that functionality to it, and that's not very far off now.
Yeah.
Are you looking at the South Korea system in that instance? So are you looking at the South Korea system in that instance, tracking mobile data and spending data? It would require sort of a legislative privacy change, I understand, but it's pretty accurate.
Yeah, well, actually, for the phone, from what we've seen, the likes of Singapore, obviously the COVID Tracer is modelled, some of the elements of the COVID Tracer are modelled on the Singapore app, and they were the ones that actually acknowledged that there were issues with the functionality of that app. So we've seen now that they're moving, for instance, with their older population to almost a separate dongle that is worn. That does similar things, as I understand, to the COVID Tracer card, which has been trialled on a small scale in New Zealand at present. And so that's where I think you see some of those solutions. When it comes to people using their bank data, there's nothing currently stopping anyone who's found to have been COVID positive, of course, giving permission for their bank data to be accessed to be able to trace where they have been.
And mobile data as well, because sort of almost everyone carries a smartphone with them. Anyway.
Yeah, not everyone, of course, but yes, a large number of people. But again, nothing to stop people giving permission for this information to be used.
The thing that you're looking at is a system that you could, if you are identified to have COVID-19, then you then hand over permission for that data.
There's nothing to stop individuals saying, look, I give permission for you to access information, or I'll support you to access information that will help retrace my steps. What it doesn't do, though, is if we find that someone in doing so finds an EFTPOS receipt from a cafe that they went to 8 days ago, doesn't tell us who else was there. And so that's where people keeping a record themselves, and the COVID Tracer app allows us to then contact those people automatically, and that's why it's so important.
If the tracing is so important, why not bring back some of those restrictions that you had in level 2 that requires businesses to track everyone in their premise?
Because we have now the ability for people to take responsibility for tracking where they have been. We have that. But of course, what it requires is an individual taking responsibility for doing that. Even if you put that responsibility on a business, it's actually still the person walking into the business who's scanning or writing down their details. And having seen some of those records, I saw people who did not accurately write down their details. In all of this, there is an element of personal responsibility here. We need New Zealanders to acknowledge that it is their job to keep track of where they are going and to support our response.
If we're talking about extra layers of protection, though, is that not just an extra layer of protection?
The COVID Tracer app is an extra layer of protection, which is why we're asking people to use it. It is not in itself a complete solution, which is why the ability to scale up with physical people, doing the interviewing, doing the tracing, finding people, making sure they're quarantining and isolating, all of that needs to stay as well.
Can I just add to that one of the very important principles that we've used here is that people own their own data, they own their own information. Whereas if you're going to a business and you're signing a book or they're using a different system, then they potentially own your information. So the COVID Tracer app is all about people controlling their own data. They control what gets recorded and who that gets shared with. And I think that that's been very important to public confidence in using the system, because people are a bit, worried about other people recording their information.
Current thinking on forming a bubble with Rarotonga?
Look, I did have a conversation with Prime Minister Puna a few days ago, and what I conveyed to him is that I have asked officials to work on some timelines for our border movements with realm countries, keeping in mind these are individuals who carry New Zealand passports, and so they are in a different category. I have no set dates yet. Then for any reopening with realm countries, it is an issue we continue to work on, and to say that we've got particular dates yet would be premature. But I am continuing my conversations with the Prime Minister of the Cook Islands and with others.
Potentially like months away, weeks away?
I have never set a timeline or a time frame around it. Our number one focus has to be making sure that we keep both New Zealanders safe, but also places like the Cook Islands where they are COVID-free safe as well. There are some real practical issues. At the moment, our airports don't separate out individuals who we might be certain are COVID-free from those who are not, because when they arrive, there is no way to know for most of the passengers coming in. So we would need very strong physical barriers, different staff interacting with different groups, a number of practical things that would need to be in place.
What is the current level of sentinel testing?
Sentinel testing, Minister?
Sorry.
So you mean surveillance, just our general surveillance testing?
Look, I haven't had today's data. We'll get into that later on this afternoon. I can only give you yesterday's data because I've got the latest breakdown of that. So yesterday, the number of tests was 1,620. 516 of those were in MIQ facilities. About 2,000, at the high level, about 2,000, just over 2,000 tests done today, but I haven't got the breakdown of that yet.
Are we targeting when we are doing that random testing?
So new guidance was issued last night. That went out, as I indicated yesterday when I did my media conference yesterday. So our first priority, of course, as it always has been, is all people who are symptomatic and meet the high index of suspicion criteria that's been issued. So they all should be offered a test, and that has been the case right the way through. Adding to that, though, and this is further guidance has gone out last night, clinicians are also being encouraged to offer tests to others presenting at health services with symptoms that are consistent with COVID-19 and who are likely to experience more severe consequences if they were to contract COVID-19. So that group includes seniors, Māori Pacific people, those who've got significant pre-existing conditions such as chronic obstructive pulmonary disease, high blood pressure, heart disease and diabetes. They're also being encouraged to offer testing to any symptomatic healthcare workers, any workers in aged residential facilities. With that extra guidance, those extra groups being brought in there, our expectation is that will start to bring those numbers back up again.
We also, of course, have the ongoing expectation of testing of workers at the border and in our MIQ facilities as well. Yeah, Jackson.
Prime Minister, in your recent conversation with the Australian Prime Minister Scott Morrison, was there any discussion around Trans-Tasman bubble, and did Mr Morrison say whether Australia was open to opening up to New Zealand on a state-by-state basis?
Look, I think from our perspective, neither position for either of us has particularly changed. We've always said that any Trans-Tasman bubble would be dictated by what is happening with COVID in our respective countries, whether or not we consider it to be safe. So that criteria remains. Obviously, there have been developments in the state of Victoria. There look to be some knock-on effects in the state of New South Wales. And so obviously now is not the time. That preparatory work though, we keep that in train, but we will only entertain a reopening if and when it is safe for New Zealand to do so, and now is obviously not that time.
Amelia's question line around using cell phone data.
I'm sorry, whose question? Amelia's, yeah.
On using cell phone data and bank data, kind of on a wide level, not an individual level, to be able to say, look, this outbreak happened here, we can track everyone who spent money at this cafe. Are you basically saying that the privacy threshold there is too high?
No. I'm saying that I have asked the question around whether or not, when you're doing an interview, whether or not we can have, as part of just our general interviewing, the access to talking through access to cell phone data, EFTPOS transactions and so on. What I haven't personally explored, others certainly may have, is the question of whether or not you can then ask any premises to explore all of their bank data for several trading days. So, sorry?
Ask Spark for a squeak along with
Yeah. That question also equally is something that I do believe our Minister Farfoy may well have been asking some of those questions. But again, actually, if we have people using some of the devices that we have, then they can own their data and we then don't have those wider issues. But again, those are questions that I'd put to Minister Farfoy because he's been working on that as part of our wider technology use.
As Prime Minister, would you personally be comfortable with that level of privacy intrusion, or is that expected far?
My view is that we've got a device, we've got a mechanism that does already protect people's privacy, protects their data, but also helps us to reach them. So we have that available to them and we should be using it. I have always been willing to ask these questions around what we can do to just go a bit further to make sure we've got protections in place, but use what we have. And I have been willing to ask those questions.
Will New Zealand ever really be safe with the levels of the very low levels of compliance that we're seeing with the use of the Tracer app? Is there anything other than the COVID card out there which would potentially raise the level of compliance to a much, much higher level?
Yeah, again, we do need to just come back to what are the fundamentals of strong contact tracing. No country in the world is relying solely on technological solutions, and there is good reason for that. The most important thing for us to still establish people's close contacts is personal one-to-one interviews carried out multiple times and then followed up by a team of individuals to ensure that others who have been close contacts are isolating and are tested. So that will still remain key. What we consider these technological solutions to be is an extra safety net on top of the core activity. And so we will never solely rely on them. I think to do so would be foolish. We do, however, see what they can add if they are utilised.
Can I just add to that the big thing they offer is speed. So if you imagine our current effort relies on those interviews that the Prime Minister said, that process takes some time. It requires multiple interviews, and I'd encourage every one of you, if you want to test this out yourselves, you can sit down after this and work out everyone you've come into contact with in the last week. If you do that exercise yourself, you realise it's not as easy as you might think it is, and it takes a lot longer than you think it might. So the thing that the QR code system does is it means that on day one, you can basically hand over some data. That means you're already the first step well ahead in the process. And so even if there are subsequent additional contacts that are identified through the interviewing, we're already underway with the contact tracing well in advance of that. So it's speed that we get through that.
Do you have any thoughts of further communication spend to get that message out? Because
we
I think
have.
New Zealanders
Yes.
as a
Yes, we have.
Yes, and look, there's more coming on that, and we'll have more to say about that very soon.
And so I think it is fair to say that we do need to keep ramping that up and reminding New Zealanders to use it. I think if we have in that intervening period, we are seeing more businesses using those QR codes, and my message to them as well, put up the poster. Make it as easy as possible for individuals coming into your business. We've always said we wanted to rely on them voluntarily doing that. I think we're now at a point where if we don't see widespread use, we might think about whether or not we need to take that a step further again.
On the framework.
I'll come here, then Bernard, and then I'll finish.
So on the framework,
sorry. Yeah.
On the framework, are you looking to make the alert system more nuanced based on what we now know about the virus? So if sort of at regional level 3, there would be mass masking in that region,
yes.
or not necessarily cafes and bars, but sort of, retail shops could stay open.
Yeah, I think you will still see us, broadly speaking, using the alert level framework. But you raised rightly the issue of masks. That is something that previously wasn't part of our response. I think if we saw outbreaks, you would see very specific guidance on mask use in those circumstances as well. Yeah.
With contact tracing, clearly there's no system that is perfect. So the one that we're currently using, the imperfection there is that nobody's using it. And the other
I don't think that's entirely fair.
I'm using it.
I use it.
And in terms of the technology...
Are you confessing?
I am confessing, yes.
Yeah.
In terms of the technology being used as a backstop, there's no perfect solution either. Would it not make sense to use a number of these imperfect systems and at least have more imperfect systems in use as opposed to fewer imperfect systems in use?
I've seen nothing to suggest that we're somehow better off by having multiple, when actually what we have now with this system is the ability to go out and notify people. And that's something that is, I think, really key, that we can, through the Ministry of Health, go out and notify people who were at specific venues at specific times and tell them that, look, please go into isolation. Will there be in contact to establish whether you were a direct contact and need to stay there or not? That gives that speed that sometimes other apps providing, which is why, again, because I know how it works and I know what it will do with your data, I can tell people hand on heart that it is a system that looks after their privacy. I cannot guarantee that with other apps.
For example, people accept that we're being tracked all the time, and we don't like it, but we just do accept it. If we did use the Bluetooth, for example, even if it wasn't quite working
I see what you're saying.
And combining that with the app and with a number of things.
And look, that is an COVID Tracer app that is still in play, as is the COVID card. So both of those are still in play. We will keep using technological solutions and developing them. Bernard.
For the Minister, what advice have you had from the Roche Committee on how effective the current tracing system is, and whether or not you can go to this regional approach without an improvement?
So they've given me, or they gave my predecessor, Dr. Clark, some feedback on their first look at the system based on the Viral report. So basically checking, have the recommendations of the Viral report been implemented, and if so, how effectively? I met with them last week. They're actually giving me an update on that initial analysis, and I should receive that this week. The Ministry of Health are also giving me an update on the implementation of those recommendations. The vast majority of them have already been implemented. There are still a few that take a little bit longer to implement, where that progress is still ongoing. But I do want to reiterate here that to get to the gold standard that we've talked about, all of us are going to have to play a role in making sure that we're using the contact tracing solutions that are provided.
Okay.
You go to this regional approach when you don't have the gold standard.
Oh, again, I think you're misinterpreting what the Minister is saying here. We have created the framework. We've generated a system that works. Now we're asking people to use it. And again, as I've already said, in many of the countries that are using these systems, no one is relying on them solely because they are not foolproof. They are in addition to the core framework, which will always be physical people on the ground. Anna.
The behavioural change that you're seeking is basically just about a behaviour as soon as you enter like a premise. Do business owners need to be a bit more proactive in just requesting that people sign in?
Yeah, that would certainly help, because many of us will remember when you saw hospitality venues reopening, people were really vigilant. They did ask customers to make sure they'd signed in before they came in. And we're asking for that simple vigilance again, just asking people, do a quick scan, take a quick note, make sure that you are that you've registered as coming in here. That all of those extra little additions will make a big difference. I know it's hard for people to remember when we are in a situation where we've been COVID-free in the community for over 70 days. But what will keep us COVID-free is if everyone continues to be vigilant. So that's what we're asking our team. Okay, I think we'll call it a day. Thanks, everyone. Thanks.